How are you all doing today?
Good.
Good, good, okay. Well, welcome to the Mashpee Men's Club on this beautiful Cape Cod morning. And we begin each meeting with a pledge of allegiance to the flag. And it's always led by a veteran, and Al Toll is gonna do us the honor this morning of leading us.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Al. But we have three wonderful speakers lined up, and I'll introduce all three of them at the beginning here. We have Heidi McLaughlin, who is the director of the Mashpee Council on Aging and also director of the Senior Center here. She is responsible for the many outstanding accomplishments and activities here at the Senior Center. Heidi has been a great help to us here at the Mashpee Men's Club, and she has dedicated nearly 23 years to serving the town of Mashpee, 20 as Assistant Recreation Director, and the balance as Director of the Council on Aging and of the Senior Center. Heidi is passionate about community engagement and enhancing the quality of life for residents. She brings experience, leadership, and a deep commitment to public service. Outside of work, she enjoys any type of physical exercise, spending time at the beach, and making memories with family. Lori Nelson, who has a master's degree in counseling, has been Senior Center Outreach Coordinator since 2019, following a career in the social service field. Lori has lived in Mashpee for the last 35 years and is passionate about helping others. Her goal being to provide the highest level of support and advocacy to every Mashpee resident. She too is ready for any athletic challenge when not working. And then our third speaker today is Carol Thomas, and she is with the Oasis Senior Advisors out of, you say Plymouth?
Well, they're based in Plymouth, but out of the Cape and South Coast.
Right, right, and Carol is gonna talk to us about people that we might know, people much older than ourselves that might need placement in some kind of senior assistance center, and she'll be talking more to that, and she'll be handing out some cards that we can put in the drawer that we can hold on to for the future, 50 years from now when we might know somebody that needs assistance at a senior center. So we appreciate all three ladies being here this morning and talking to us. So with that, I'll turn it over to Heidi. Thank you all so much.
Come up with Heidi.
Stand up here and do it.
We got video.
I'm a team.
We got a lot of video. I don't know if it can be filed.
Not my specialty, PowerPoint, but good morning. Thank you all for having us here today. Kind of funny to be speaking in our own building about our building, but I don't know. I see faces in here who come in for some programs and others who I see just for men's club. So hopefully after today we can get some of you in for some of our other programs, or maybe you are in need of some services that you aren't aware that we have. So that's what Lori and I are here today to talk about. And Carol, yes. So just a little bit about the Senior Center. We are open to anyone 60 and over. You do not have to be a resident of Mashpee to come to the Senior Center. We're open to non-residents as well. Even younger people can come here. We do prioritize the Senior Center for those 60 and over. So if it gets to a case where a program is going to be full and we have a capacity issue, obviously we're gonna allow the 60 and over and Mashpee residents as our priority. Just a little bit about what we're gonna talk about today. We're gonna look at healthy aging today and what that looks like. An overview of the Council on Aging, the services that we have available, and then we're gonna have Oasis here talk as well, and any questions that you have. Can you all hear me okay, or do you prefer I use the microphone?
Probably should use a microphone.
Okay, not a problem.
He's deaf.
Huh?
What?
Can't help it.
What?
Huh?
Very good.
All right. So, just a little bit about the Council on Aging and how it came to be. Back in 1971,
Can we stop for a second? Just, you're missing some slides.
Right.
The one
Oh,
thing-
oh, oh.
Yeah, there's a couple of those. There were introductions, but actually we
Oh,
did
sorry.
that at the beginning. And I'm pretty big on one of my last jobs, I worked as in human resources in a social service agency and dealing with employee safety. Actually, Dave was a colleague of mine years ago. And safety is really important to me, so whenever I do any type of presentations or whatever, it's a reminder to all of us that, emergencies can happen anywhere, so whenever we're in any type of building, you should always know how the heck to get out, right? So in the event, we needed to get out, we're lucky, we have two ways, one right there, go through these doors, and there's a door right there, and you can exit. The third way, if for some reason we couldn't go that way, is out the same way that you came in. Fire extinguishers is also near the second exit, which is right out the door there. And medical emergencies, many of us are trained in first aid and CPR, so I'm sure we'll all be well taken care of. Now you're up.
all right. Sorry, I skipped ahead there. So back in 1971, a special town meeting, the town voted to start a Council on Aging. They had Article 12 and 2 articles under that. They voted to open a senior center. And they also voted to have a board of 7 members, which is called the Council on Aging Board, which is still in effect right now. And I think right now we have 9 members on our board. Or 9 seats. We have 1 vacancy if anyone's interested in being on the Council on Aging Board.
It's only once a month.
All right, next slide.
Yep.
All right, just a little bit about the growth you can see here of the town for the population of 60 and over. If you look at 2000 here, our number was 3,050, 60 plus residents in Mashpee. And jump ahead to 2024 census, we're at 7,039, so roughly 46% of Mashpee's population is 60 and over. So, and, I think that trend is only going to continue to increase, or that's what, we're hearing anyways, so I think that's true. Cape Cod's a retirement community for many, a lot of people are moving here. It's a great place to live if you can afford it, so. And if, for those of you that don't know, also the total population in Mashpee is 15,165. So, almost half, 60 plus. So back to the timeline here, 1971 was the creation of the Council on Aging. The first senior center opened in 1976. Can you jump ahead?
Yep.
All right, so here we are. This building was moved from Camp Edwards. This is the original senior center. Apparently it was the old beauty salon at Camp Edwards, so they moved it to Great Neck Road North, which now is the Kids Club Child Care Center. I'm sure many of you have driven by it, but that's the original building, 1976. And this is what it was converted to in 1994. Let's see, and then they had done a feasibility study. I forget, I think that was around 2000 maybe, or 1996, they did.
2001.
Okay, 2001, they did a feasibility study to start plans for this new senior center here, which was built in 2004, and it opened in 2005. So 20 years we've been in this building, or this building's been here. I haven't been here. And this is a history of the senior center directors in the past. So I started here in May of 2022, and I feel blessed to have been granted the opportunity to be here and be the director. You know, as I said, I was in the recreation department for many years, serving the younger population in Mashpee. You know, we served some of the older residents mainly for pickleball. So anyone here play pickleball? No? Okay. You guys don't know what you're missing. So just history on that.
So why are we here today? One, you asked us, and we have been trying to go out into the community as much as possible to kind of shout our stuff. Look at the increase in our population in general, and also our senior population. I want us to be heard as much as possible, but also for people to understand all the stuff that we have going on here. Historically, senior centers have a real misconception of just, oh, I'm not gonna go to the senior center. That's a bunch of old people. And I said that if that's your attitude, don't come to us, you know. I'll come to you on outreach at some point. But we really want people to know how much is available to Mashpee residents, and how you can reach out to us as needed through the aging process. And there's a lot of research now for folks. I'm sure you do some of the research and looking at aging today. It's a heck of a lot different than when our grandparents were aging, right? I mean, when they were probably 20 years younger than you were, they were really old, right? And now the aging is so much different. We've learned a lot in the last 50 years about health and how to take care of the body. So we can't stop the aging process, but we can certainly help it along. And my job as outreach is really, how can I help you guys through the outreach process? Through the aging process. And there's a lot that hopefully we can get to you by listening and paying attention to some of our presentations. And Kathy here is a great resource for us and also for you when she gets a moment to chat. So let's see. What's amazing now, there are more people over the age of 65 in the country than ever before in time. We're living longer. We got a lot different medical support to help us through a lot of the crises. We've all been through some type of crises, most likely, during our lives to this point. My job, our job, is how can we help you to age well? The numbers are going to continue to grow, and when Heidi talks about the data, I want folks to know, to be honest, in senior centers and councils on aging in the state of Massachusetts, the percentage of the town budgets, I'm a town employee, is 1% to 2%. But yet the data says something else, doesn't it? So if you hear more and more, if you were there last night at the town meeting, thank you for your support for our activities, because that's what our biggest draw is. Let's see. Come on, babe. Oops. And again, before I give it to Heidi, you know, what I want to do here in my job, my passion, what I want to do to help each and every one of you is to inspire life balance. And are we doing it? And to remind you that we need to focus on this. Oh, I've exercised enough. I exercised my whole life. Well, that's good, because now you've practiced enough. When you really need that exercise, you really need that sleep, You really need that good nutrition. Now is the time. Implement those things that you've learned along the years. It really does make a difference. Moving, during COVID, my job was really to help a lot of those, all of us actually, calling folks and seeing how you're doing. And I had this vision, and I know for some it actually was true. How you doing today, Marge? I'm doing all right, you know, watching the news, this is all during COVID, and I can see over the months, they're going down, my back's hurting me. Well, are you getting up, are you doing anything? No. So they're just miserable because so many of us during that time, what do? We stayed home, we isolated, and we sat, and our bodies paid the price for it. So I really want folks to continue to work on that, and again, I'm really passionate about it. The other piece is just about connections and connections with others, the relationships that you have. A big concern that I have, and something I have to deal with every day, is many Mashpee seniors who are isolated and alone and have no contact with another person perhaps. So I want to get people connected because that's an indication of poor aging. We got to do all these things to stay well. And I think Heidi's got it now.
All right, so we're just going to talk a little bit about the aging system here in Massachusetts. The Executive Office of Aging and Independence is, they were formerly known as the Executive Office of Elder Affairs. That falls under the Healy-Driscoll administration. Their mission, as you can see, is to support aging adults to live and thrive safely and independently. So this is why they recently changed their name to the Office of Aging and Independence, because they're trying to promote healthy living, people living longer and independently. So they want every person to have the tools and resources that they need in order to do that. There is a lot of work and research being done out there, and they just wanted their name to reflect their mission and their goals. So I think that is a much better name than they had previously. Let's see, here are some of the resources, and you can find this if you ever go on their website. All of these categories, aging services, they have a wealth of information, so I would encourage all of you maybe to go on there at some point and look at these. They have lots of supports for family and caregivers. If anyone's aware or knows of anyone suffering from older adult abuse, I mean, that could be just someone taking care of someone in the home. There's supports out there for that, or a spouse. You never know. There's assisted living resources for every place in Massachusetts. You can find all different, care levels. There's so many different kinds: memory care, assisted living, just older communities for 55 plus. So all of those are on there as well. Shine is one other resource that they offer that is one of our most utilized programs here. If you don't know what Shine is, it's serving the healthcare needs of everyone. We have counselors here every Thursday all day, so if you ever have any questions about your health insurance, Medicare, feel free to make an appointment with one of our people here. They're great, they're trained, they go to trainings once a month. Can't say enough good about them. So we fall under the state. There's 351 councils on aging in Massachusetts. Pretty much every town has one. We are lucky to have this building, and I think it's beautiful, and the support that we receive from the state is awesome. We receive funding from the state as well. This last year, they approved $15 per person 16 over in the town of Mashpee based on the 2020 census. So we are lucky enough. That helps fund a few of our positions here. We also fund a lot of other events and just services that we have, people coming in, speakers, so we use money that we get from the state, because the money that we get from the town is just minimal, basically, expenses for building and staffing, so, we're very grateful to the state for their support.
And let's hope it, we all know that, there's a lot of talk about budget cuts and what the heck's going on, and we can't worry about that. We gotta do our job of taking care of the folks over the age of 60 in Mashpee, but any advocacy you can provide to us, if the time is needed, I appreciate it.
Elder Services of Cape Cod and the Islands is another big, they're under the umbrella of the Executive Office of Aging and Independence. They are a nonprofit based out of Dennis, but they serve Barnstable, Dukes County, Nantucket. They're a federally designated area agency, state designated aging services access point, and they are there to provide services and anything that you need elder related as we age. They are the ones that we often refer you to.
I think that's an important point too, because when I say, have you talked to Elder Services yet? I thought that's who I was talking to right now, and a lot of people know that. So again, the reason we wanna kind of let you guys know what we're doing is to understand the separation. I know it's a lot of information, but to kind of understand the process that we go through.
Okay, so I already introduced myself. This is just an overview of our staff that we have here. Lori's our outreach coordinator. There are 3 full-time employees here that operate the building. Last night, we were fortunate enough at town meeting to have our activities coordinator, John, who's wonderful, does such an excellent job planning all of the activities, events, programs here. His position, we successfully got that moved. It was being funded by the state with the formula grant. Now it is gonna be funded out of our operating account. So that was approved at town meeting last night. He's gonna be 37.5 hours. He has been working 19 hours. Actually, he's been putting in a lot more than 19 hours because he's passionate about the job and enjoys being here and enjoys providing programs to the older residents here in town. So starting July 1, John will be full-time. We have 2 receptionists, Peggy and Rochelle, that are at the front desk morning. One works morning, one's here in the afternoon. We have Kathy, our volunteer coordinator. She meets with anyone who's interested in becoming a volunteer and works with them to see what their area of interest is. Maybe they want to run a program. Maybe they want to be a friendly visitor to someone in the community. They're looking for people for Meals on Wheels delivery, which actually is through Elder Services, but, so she helps point people in the direction of where their interest is. Carolyn is our administrative assistant, and Lisa is our office assistant. She's the one that is in charge of doing the newsletter. If anyone gets our constant contact emails, Lisa puts those together. We do a weekly article in the Enterprise, so she sends information to that. And then we have our PowerPoint in the lobby, which reflects all of our monthly activities. So, we have 2 minibus drivers for our minibus van. We operate that 4 days a week, Monday, Tuesday, Wednesday, and Friday. So Tim and Ron are our 2 minibus drivers. That is a handicap accessible van. They do prioritize medical transportation, but they also take residents to the grocery store, the bank, pharmacy. They do go to Sandwich quite often, to OCB, because we all know a lot of us need to have our eyes checked and cataract surgery, so, they're our guys. And then George, you've probably seen around here setting up the chairs in here. He's here 5 days a week. He's part-time maintenance worker. So we have a great staff, very, very fortunate to have awesome people here. And then our volunteers, we couldn't operate without them either, so. Here are just a few pictures of events that, we do a lot of food events and they draw a lot of our older residents. Everyone loves a free meal.
You have food, they will come. We've learned, that's our research is showing that.
Yes. We're actually having a dance tomorrow night, so if any of you.
Anybody coming?
Oh, come on. Nobody? We do. You could still sign up on your way out if you want. 6 o'clock, we're having a dance tomorrow night with a DJ.
Wow.
Yeah. So, we had a women's self-defense here. This is Kim. Zumba is one of our most popular programs. They had, I think, 40-something people in the Zumba class the other day, so that's pretty popular. And then we had coffee and conversations. We were trying to have different speakers every week come for our coffee hour. So please come to something else. You know, we feel like we have something for everyone. So try and check out some other program besides coming here for Men's Club if you haven't. And these are just some of the things we checked on. Connections. So if you come, you know, you're connecting with other people, staying social, and that's very important as we age. Even if you have a spouse at home, it's good to get out and meet new people, which you can definitely do here. Lots of fitness opportunities, and it doesn't even have to be exercise classes. Jim here comes and plays ping pong. Him and I have played at least once ping pong, so come join that. We're looking for more people to do that. We have a bocce ball court that just was built by DPW. We're doing our grand opening for that on May 21st, so if you're interested in that. In the summertime, we have one of our volunteers and board members, Ron Meyerowitz. He's got a cornhole game going on, I think it was Thursdays last summer, so that'll probably happen again. So there are a lot of opportunities. As I mentioned, there's health screenings. We have the VNA that the town has a contract with on the first, I think it's the second Monday of every month. The VNA nurse comes in and she does health screenings for people. You can get your blood pressure checked. If you have any questions about your medication, you can ask her. We do a lot of other programs with the VNA, stroke awareness. They have a lot of fitness programs that they do, arthritis exercise class. There's a men's strong at heart exercise class. So just, you know, your tax dollars are paying for a lot of this stuff. So it would be great if you take advantage. Veteran services for any of our veterans. We have Greg Quilty from Hyannis, who's our veterans officer. He comes and he helps answer any questions related to that.
How many folks have used Greg here? Okay. If you ever have any questions, he is really good about uncovering things that we didn't know about. And I have a lot of women who lost their husband who actually find out that they're entitled to some benefits. So if you are service connected, it might make sense to even just check it out.
With our new software system that we got a couple of years ago, we can pull some data here, which this just breaks down the number of people basically that we have attending different areas. So as you can see, our fitness and exercise programs are by far the most popular. Our social events are second most popular, and then we
Free
go
food.
down.
Free food.
Group support is another area that we have. We have dementia support groups that meet here twice a month.
Three
We have-
times, actually.
Yeah, and the Alzheimer's group also meets. We have a bereavement support. I know I'm forgetting a couple others, but there are plenty of,
A sight loss is
Yes.
the one that we do.
so, yeah, so that's just a little
Just for data.
information, yes. we have My Senior Center, as I mentioned, is our software program that you guys scan in when you check in here. That's basically us collecting data that we have to then submit to the state. That helps us with our funding. And My Active Center, we started an online registration program where you can easily go on and sign up for any programs that you would like to here. We have a Facebook page for anyone who's on Facebook. We try and keep that updated with pictures and just captions of events that we've done or anything upcoming. This is our town website. And for anyone who has a computer, maybe you just got a new computer or a new phone and you aren't sure exactly how to use it, we have support for that twice a month. We have Evan who's here the first and third Thursday of every month. You can make an appointment with him and he'll help you with emailing or pictures, anything. So.
Even just to clarify, you got this new phone, and what the heck is it? Maybe just having 20 minutes with him, he's gonna be able to describe it a little bit easier for you, perhaps. We really try, if you see all the activities, this is information, this is programming that has been requested by you folks. Some of it we do because of the industry, you know, the dementia support, and a few others. But this is, we wanna have activities, like the exercise programs, how much that has evolved because you guys have wanted more. So we do listen too, and we wanna hear feedback. This is your senior center. And we wanna make this the best for you as you continue to age.
We do have a suggestion box out in the lobby as well, if anyone has any suggestions. We look at those regularly, and John tries to make anything anyone's interested in, he'll try and make it happen, so.
I won't take long because I think actually having Carol talk a little bit too about some of the next steps, and maybe when we start having some considerations of, am I gonna have to leave here at some point due to these medical conditions or whatever it might be going on? And I have found Oasis senior advisors so helpful to me as a professional, and how they go above and beyond to help folks out. So I do refer folks to these guys too. But this is kind of a snapshot of what I do here. People see me around. I do have a busy job. There's a lot of need out there in the community. If you have a need, please come and speak to me or call me or do whatever you need. Don't do it alone, okay? These are just a variety of things. Financial issues were a lot this last year. Had a lot of folks, more folks on fuel assistance than we've ever done before. SNAP, which is formerly known as food stamps, a lot of folks. And you'd think, I mean, I've had a few women who have reached out to me after their spouse died and said, Lori, I'm really hurting. I don't know if I can stay in my beautiful home. So we're trying to get some more resources for them. You know, there's a lot out there that, one of the things that I learned probably the first day of my job here was how chaotic, confusing, and maze-like is trying to get help when we're aging. There's no easy way to figure it out at times, and that's one of my jobs, is to help you navigate the senior care system. Because there is a lot in there, and I suggest if anybody does ever have any needs, to reach out ahead of time. I love it when I have people who come to me because they've known me for years now, and anybody who knows me, I think I'm pretty approachable, and I think I've been extremely helpful to a lot of folks. So I want to try to help before there's a crisis. I have a lot of folks who will come to me and say, no, I'm okay. And I have to continue to go as I'm concerned. There's only so much I can do. But just please pay attention to what your body's going through, what your life is going through. And if you need some help, maybe I could be a beginning start for you guys. Any questions on any of these programs?
how do people approach you? Do they phone you or?
Yep.
what?
Yep, they can phone me. Oftentimes, people will see something in our newsletter, and if you don't have one of our newsletters, please pick one up. They're new, May and June just came out, I think, last week or 2 weeks ago. But you can call me. Oftentimes, I get calls from Elder Services, or I get calls from the VNA, or I get calls from the inpatient units. I get a lot of calls from your kids.
What's the best number to reach you?
It's the main number here, 508-539-1440. I do home visits, but if you are struggling or know somebody who's struggling, feel free to give me a holler. There's also, the last three there, I work with the police department. I work with the police department and the fire department pretty closely. I get the reports for the EMS and the fire, and it is amazing, guys, how many people fall. It is the #1 leading cause of injury, and I want to say death too. Yes, and death are falls. What happens and what I've seen and what the research says, when I just lost my track completely. Thank you. Yes. Back. It cascades into other problems for a lot of folks. Do a little Google research or something on it. Please. Now see, don't do this. That would be a good illustration, right? Oh, I can do it, or I wanted to get, and that's what we do, right? We all take shortcuts because we have to get it done yesterday. As we're getting older, please, I almost cry sometimes when I read some of these reports. They're preventable in so many ways. I know I can get this. 86-year-old woman who has back issues. I mean, it goes on and on. But Lori, I've done it so many times. So I guess one thing, if there's only one thing that you get out of here, take a look at your behavior, your safety behavior. Are the things that you're putting yourself at more risk on? But I did want to talk about, so I work with the police department, going on with that a little bit more. We have 3 programs. The reassurance, yes, I'm sorry.
You're talking about balance and falling. For the last 2 years, I've been taking Tai Chi for healthy living here, and I'll tell you, it has really helped me with my balance. It's mild exercise, and it's enjoyable. And I would suggest to anybody, give it a try. It's a lot of fun.
Thank you. Yeah, it is. And it's a good way to connect with people, and
Yes.
people always have a good time. Our instructors really are amazing. And we get a lot of feedback on that. But a reassurance program is, I'm alone, I live by myself, no kids, or the kids are in California, and I don't do anything. And they're a little nervous about their own safety. So we have a program where you would have to call into the police department between 6 and 10 every day of the week. If you don't call by 10 o'clock, they're gonna call you. If you don't answer that, what do you think happens next?
You get arrested.
Bingo! Yeah. Or they might come out to see you, if, depending on what you're doing, you may get arrested. Yeah, so they'll go and do a wellness check on you. So a lot of people, and I'll be honest, it's all women, find it really reassuring. It gives them a little bit more safety in their minds. Also for folks who are Alzheimer's or some type of a dementia or memory loss, we have a registration program, so whenever that phone number is called, there's a nice piece of information that comes up on that dispatcher screen that says, this person has memory issues, this is what's going on. So it's a really nice assurance for some family members. And the disability indicator form is pretty much the same thing. It could be for hearing loss or vision loss or those type of things, any other type of disability. So there's a lot out there that we do, and I try to encourage everybody to know what the programs are. If there is a point in your life that you may need them, or you're thinking about it, call me and I'd be glad to share my thoughts.
How do you overcome the traditional masculine feeling that they're invincible and they don't need this help?
It's not just men. We are independent, we've done it our whole lives, but don't we kind of have a little bit of fear? Because my kids are worried about me, they live so far away, they want me to move closer to them, they want me to live with them. And that's where do you want to share anything on this right now?
Sure, yeah.
Because I think that's a good point of how do we get over this? The more educated we are, the better we're going to do it. And I think Carol has some good points, I bet, in regards to this. So good question.
All right. Hi, everybody. Thank you for letting me join the party here. I appreciate the invitation from the Men's Club and from Lori and Heidi and the Council on Aging. I do find, before I get into talking about what I do, that the Council on Aging are such a great resource for so many questions, concerns, or issues that you have. I've had the pleasure of working in senior care for over, I hate to admit it, but 37 years now. And it's changed dramatically. Everything changes, as we all know. But it is amazing how much our needs have increased, but the services and resources that are out there are massive, and they just keep growing. But I find that the Council on Aging are a great place to start. And you can say, gee, I have a concern question about this or this. Can you help me out with it? And then inevitably they'll be able to give you some guidance. So I can't say enough about how positive the Council on Aging are.
And ours is the best in the state.
The Mashpee one is the
Okay.
best in the state.
I'm not competitive, no
Hands
athleticism
down.
here.
Hands down. So my name again is Carol Taylor. I'll tell you a little bit about what we do with Oasis Senior Care. But again, what's important to me personally, and I think is important to most people, is just knowing that we have options out there. So as we all go through life and life changes, you always want to know what your options are. Because we all have different ideas on what we like, don't like, what we can afford or not afford. So it's nice to know what is available to you. So I've worked in nursing homes for many years, and then I worked in the assisted living field for many years, which includes memory care and some independent living. The home care industry has exploded and grown tremendously, as have the visiting nurses and hospice services. So there's many options out there. What I do with the company, which is called the Oasis Senior Advisors, is we get calls from people who are starting to consider their next steps. Their next step could be a move into an independent living community, assisted living, or possibly memory care. So we get the calls. What we do is we provide a free service to that person and their family. We talk with them, we do an in-depth consultation to understand what their needs are, what they're looking for, what area they want to be in, live in, and their finances. Because everybody's finances are different, and we all look at our money differently as well. So we do an in-depth consultation to find out all of that information, and then we share with you what resources and what communities are available to you. We can help you with going on tours, setting up tours. Just yesterday, actually, we met with a family. We've had several meetings with them. We brought them to 3 different communities. This particular individual's younger. She's in her late 60s, but has a lot of medical changes. We gave her 3 very different options because of where she wanted to be. And she finally made a decision, but it included 3 tours, and then we actually gave her a full breakdown of the costs and services and the pros and the cons. so that the family and she could look at it and understand, oh, that's right, because it does get confusing. If you go to more than 2 places, it just becomes overwhelming. So we'll lay that out for them in black and white, so they can take some time to look it over, and then it's their decision as to where they want to go, if anywhere. But we try our best to give that information to them black and white. Our service is free to the seniors and their families. We get reimbursed if they choose to move into a community. Most communities we have a contract with. We don't have a contract with all of them. We'll still refer them to any community, because it doesn't matter. Because in the end, we know, when you're kind to others, it usually will come back to you at some point. But it's important to know that you have those choices and the options, and we're happy to talk with people and go through all that information with them. If it turns out that person is not looking for assisted living or independent, and after talking with them, they really want to stay at home with home care, we are happy to give you the names of the different home care companies. Or if you need visiting nurses, or the name of an elder law attorney, because we find out from them they've done nothing with regard to protecting themselves with power of attorneys and healthcare proxies, etc. Anything that you need, we will try our best to help you with and give you some solutions and give you some choices. All right, that's enough. Any questions for me?
And your reimbursement is from the various homes that you would send people to?
Correct, the assisted living communities, yeah.
Do you get money from any other source? Are you're not a state agency?
No, not at all, nope. We're a referral agency. Some of you have heard, I'm sure, from the advertising, a company called A Place for Mom, or Caring.com. There's many different of these advisory companies. They're all great. We all try our best to provide great services. We're a bit different in that we do it in person, and we ourselves have visited all of these other communities. We've gone into all the independent livings, assisted memory cares. We've met with the people, and we can do hand-holding as much as they want or don't want, all the way through the actual admission process. But we only get reimbursed by those communities. Yeah. Yes.
Are you for profit or non-profit?
We're for profit. Yeah.
How many people work at Oasis?
Well, it's a national company.
Oh.
Our particular group is owned by a wonderful guy by the name of Jim Monty. Jim actually his Oasis franchise oversees Plymouth, all of the Cape, and the South Coast area.
And how many people are in your office?
Oh, there's 4.
4.
Yeah.
And where is the office?
Well, we kind of work out of our homes, to be perfectly honest with you. So, but we each have different areas that we're conquering. Yeah.
Do you have a business card you're gonna leave with us?
I do. Yep, I have this little information card. It has all of my contact information. So feel free to call, text, or email anytime. And this is great if you guys might have neighbors, family, friends, that, gee, you're noticing some things might be changing. Feel free to just have them, give us a call. We're happy to talk with them.
Now, at what point should a person start this process?
That's a great question. My personal feeling is immediately,
Now,
right now. And the reason why I'm saying it is not because that person might need it right now, but you want to know what's out there, so you have a general concept. Most people have not been, for example, in an assisted living, and they think it's going to be just like a nursing home, and they're not at all like a nursing home. So you want to go in as early as possible. Now that we're talking about it, going in now just to get a sense of what it's all about, so that if and when you need it later on, you're going to be looking at it again, but with a different set of eyes. So right now you might be feeling great, thinking, oh, I don't need this. But God forbid, in 2 years, 5 years, 10 years, something different changes, and now you need some help. When you go in, you're going to start looking at it a little bit differently. So that's why the sooner the better, to be quite honest.
Do you have a website that lists any kind of information on
We
it?
do,
Okay.
yeah, and that's on our information cards that I'm going to hand out.
I would just like to add to that, and what I've learned through Carol and Oasis, and also a conference that I went to, we have such a fear to talk about the end of our journey here in life, right?
Right.
And I think starting now,
Thank you.
just even the conversations with your family. You know, so I'll ask a lot of folks, so what's your plan? I get different responses. The first one that I probably got, which shook me, I wanna get out of here in a pine box.
Yeah.
I don't think she wants to go anywhere, right? And she still has that. So that's really clear. But to have these conversations with your family too. So if you get sick, I also have been through a significant health crisis as well. So knowing my crisis, and it may change things for my life, so I wanna set things up now. I want the end of my days to be well, not having to worry, oh my God, I stayed in this house so long and oh my God, now I'm gonna have to go in the hospital. But if we plan these things ahead of time, different type of scenarios.
Right, yes.
If you just wanna, you're the professional on
Yeah,
that, but I just wanted
absolutely.
to highlight that.
Yes, planning ahead is the best thing that you can do. Just to give you an example, I tried to talk to my parents about setting up their own power of attorney and healthcare proxy. This is a long time ago. And my father shut me down instantly. No need to discuss it, everything's fine, we won't need it, etc. Shut me down. Now, and I had been in the field at that point for 10, 15 years. I kind of knew a little bit about the power of attorneys, healthcare proxies. Didn't matter. He didn't want to discuss it. It was not going to be discussed. And because I've had the pleasure of working in this field for so long, I know what I want and what I don't want. So unfortunately for my husband, we've been together now 29 years. Since the day we met, basically, I've been letting him know, okay, I want it, I want this, I don't want that. If and when we need to move into a community, we're going. Whether you want to go kicking or screaming, you're coming with me. And I need a social setting. He wants to be left alone in whatever apartment we get, quietly watching TV and reading his books. But I need a social setting. I told my kids, if I ever need a nursing home because of medical changes and it just happens, it's okay. I'll never tell them, don't ever put me somewhere, because that's not fair to the kids. But the one request I have in the nursing home is I want the bed by the window. I have to be able to see out and I have to be able to get some fresh air. Those are my requirements. But I think it's really important that you want to be proactive, you want to have an idea of what you want, so you have some control over it. You want to know that you can tell your kids, okay, when I get to be this age, if the kids or family don't live near you, do you want to stay in your town? Or are you open to moving closer to where the kids are? What's important to you? And you want to get that in writing to them so that everybody understands and has a clearer picture, so that that responsibility is not put on somebody else. But it's really about you guys getting control of what you want. That's important to most people.
First of all, your kids have to listen to you.
That's true.
When you try to talk about the end of life situation, they, oh, you're gonna live forever, Dad. No, no problem.
Yeah.
Yeah, one of these days I'm not gonna open my eyes.
Let's hope that
What are you gonna do?
let's hope that this changes too, because if we start talking about it earlier and planning in a more positive way, which, how can you have death as positive? But we're all gonna go there at some point, but let's make it easier all around instead of, you know, I have an aunt who, her family's not doing anything, and I kept saying, please do this, and they didn't. She's got dementia and not doing well at all. But if we planned ahead, and don't be an ostrich and put your head in the sand. Think about what's going on for you, your loved ones. Talk to your kids. And if they don't wanna listen to you, start the conversations now and bring it up, you know, every now and then. Well, let's talk about this.
I make them listen.
I've got some good information. Good, way to go. That's a dad. I have some good information if anybody wants some other resources for that too.
Okay.
Any
other questions for me?
No, a lot of folks have that.
Okay.
I think we're pretty much, I just wanted to highlight on a couple, Heidi, if you wanna come back up. Transportation here, hopefully you guys saw all this and Heidi talked about that. Please feel free to utilize us. If you have a medical appointment or something and you just can't drive to that medical appointment, we might be able to help you out if you can't find somebody else. or if you wanna volunteer for us, we sure could use some medical transportation drivers. And I'm gonna give the rest, the big boss, the big.
Just a little bit to add on to the driving. I don't know if any of you, it's hard when you get to that point, and Lori just attended a workshop on when it's time to give up your license, which is hard for many to think about. But if and when you ever get to that point, or if you know somebody else who does not have their license, I mean, as I mentioned, we provide transportation, but also the CCRTA has, worked so hard. Tom Cahere, who recently passed, unfortunately, worked really, really hard to get the Smart Dart going, which is like a Uber within your town, and it's $3. So it's $3 per, like if you're going one way, it's $3, you get dropped off, and it's $3 another way. So it's a very affordable way to have transportation. Right now it's app-based, so you have to go on your phone and request a ride that way, but they have gotten a grant where they're going to have a full-time dispatcher, and you can call in and request a ride. So that's great. And then they have the Go Card, which is free, where you can take bus transportation all throughout Cape Cod.
No Charlie card here, you get the Go Card.
So volunteering, if any of you have an interest in volunteering, if you want to stop on your way out, Kathy's here, our volunteer coordinator. Could be just, once a month, something very small. So if you want to check out any opportunities that are available, feel free to get her card or stop and talk to her. And then we're just curious what any of your experiences are here at the COA, if anyone wants to share anything, or, no?
Feedback is always really helpful to us, so, we wanna hear the good and the good, we only wanna hear the good, but we also need to hear the bad. So feel free anytime.
I think everything's been good here, and it's, I don't know if you mentioned, one thing I took advantage of a couple of years ago was a bereavement group you have run by the VNA, and unfortunately, if you have to take advantage of it, it's really very helpful, that's for sure.
Nice.
And the other question I had, maybe I missed it, you talked about nutritious meals. I know at the Falmouth Senior Center, they have meals every day. Do you have meals every day? I don't know. Yeah.
We do not. We were through Elder Services. They have a contract to utilize our kitchen every day between the hours of 8 and 2 p.m. So previous to COVID, there was congregate meals, which people could call up 48 hours in advance and sign up to come in and have a meal and socialize with others.
Yeah.
And then it, during COVID, stopped, and then they brought it back. I think it was 2 days a week they were doing it, but we were only getting anywhere between like 2 and 5 people. So they recently cut that because of the state. There was a huge deficit in the funding. So they actually, unfortunately, used numbers, I think, from 2022 instead of 2025 numbers, so the wrong numbers were projected for the budget, so now they're trying to make up for all this money that they don't have, unfortunately.
Are there Meals on Wheels?
The Meals on Wheels is definitely an option, and that is through Elder Services also. That's in our newsletter as well, so if anyone's interested in getting that started, you call Elder Services and they can get you set up with that. Currently, I think there's a wait list of maybe 40 people or so for Meals on Wheels because of a shortage of drivers, volunteer drivers. But the wait list, I think, was in the 200s, so 40 is actually not a bad number right now.
I think we're pretty okay now. I think we got a lot, but I consider I'm a team player, got a lot of drivers, so it looks like we're okay. And if you know of a neighbor, I love Meals on Wheels. For outreach, I absolutely love it. Anybody have any idea why, other than the nutritious food?
You get a visit, you get to visit
You
the
get a
person.
connection. For those people I was talking about before who never leave their home, please, 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 yes, you do need nutritious meals, you need that. And then they get very fond of whomever their volunteers. That's another great job. I would love to have that job too. So,
Loneliness is an epidemic.
Yes,
Thank
it
you.
is.
yep,
But you have to be considerate of the driver who volunteered, that you can't engage him in a conversation, because he's got places to go and things to do.
exactly. That is the challenge there, that's where we
He's
need.
got hot meals in the car.
Got it.
Yeah, yeah. But you know, a lot of these people wanna check, touch base with.
And you work closely with the big food pantry across the way on Wednesdays at Christ the King?
No, we do not,
Is there food pantry here? I don't even know.
no.
We recommend it and we refer a lot of folks over there.
So if somebody came here on a Monday, Tuesday, Thursday, or Friday, hungry, what would you do?
There's a food pantry opening up the middle school here. It's open every day
At the Mashpee Middle School?
at the middle school, wherever that is.
Good. Because I'm sure you're gonna run into that problem.
Yeah,
Right.
it's
unfortunately.
tough, it's
Yeah.
really tough, and, we don't have a big budget, we have a very minimal budget, and it'd be great to have those things, but we can only do what we can do.
Right, and we're talking about, Lori and I, talking with the Friends of the Mashpee Council on Aging, because they raise a lot of funds for older residents here in Mashpee, and all of that money does not go to support the COA, it goes to support many different services, like, they've bought a lot of, defibrillators for the town, they've helped with, they've helped us with furniture, and so we're talking about seeing if we can get a needy fund going, many towns have
Good.
those for emergencies such as that. But,
Financial assistance.
we would love to have a cafe like Falmouth has, I know that was very popular, but
Yeah.
unfortunately, we don't have the space that they do. Our kitchen is right off of the multi-purpose room, which is the room that is most heavily utilized in the building, so, to do that,
If anybody wants to give us
Would be
enough
difficult.
money, we can do a grant and then get a cafe going, but think about all the costs associated with that. It can't be
Once we
connected
build the
with.
police station, then there'll be some extra money, and
There
maybe
we
we'll blow this place up.
Yeah, we've outgrown our space here too, but we certainly can't talk about that yet. Did you want to highlight any of these?
So we have our office assistant, if you ever, I'm sure you all know the building, but if you ever want a formal tour, we have someone who can do that and sit down and go over all of our services with you, set you up with a key tag if you don't have one, which you all should have since you come here for a men's club. Hopefully you're scanning in when you come.
If you didn't, please sign in on your way out. Please, it really, you guys know, everybody knows now, numbers speak volumes.
Well, that technology you use is fantastic.
Good.
I mean, I was one that didn't want to sign up for it, I didn't want to wait a second to get in here. But boy, I'll tell you, I'm in and into the meeting so fast, it works beautifully.
Oh, yeah.
Compliments.
And it's so
Good to hear.
funny because there's a lot of folks, as you can imagine, who are really anti anything technology and they've got fear about it and they just can't comprehend that. That's okay too, but it really does help all of us to be able to get those numbers.
A lot of us look forward to the article in the Mashpee Enterprise every week too,
Oh, good,
Yeah.
good,
to
yes.
find out what's going on. yeah.
And your newsletter's great.
Nice.
Well, thank you.
Go.
Nice to hear. So please join us on June sixth, we're having an open house in our big room there, and that's gonna be, like the police will be there, the VNA, a lot of the support groups that we offer, we're gonna have representatives, in Oasis.
Where
No,
is
you're
this?
not there, where are you?
Where?
It's gonna be in the multi-purpose room,
Oh, here.
yes,
Yeah.
so starting, I think at 9:30 to 11:30,
And that's May sixth, you say?
June sixth.
June.
I think we've got another
What day
slide.
of the week does that fall on?
Right?
A Friday, yes, and we'll have some demonstrations as well, I think, Zumba's gonna be doing a demonstration, possibly Qigong.
What about the men's club? You gonna be there?
Yeah,
No, last year we had all of our groups present, but it was a little too overwhelming and tough to fit everyone in there, so we decided this year to just keep it to our support groups and, town groups that we work with.
Senior day,
We're a support group.
Senior dad,
Yeah.
We get the men out, or some of them
Live
anyway.
broadcast.
If we let
Just
you,
change,
then we
put
have to
support
let
in there,
sport-
next year you'll
Look
be
at you,
on.
Kendra.
I just, with all of these, just to kind of take a look at these, but we talked about all of those. And, this here is a guide, I've got a bunch up here, if you need one, want one, I can get you more right now. This is a guide that I think every person over the age of 60 should have. Again, just like the planning ahead, this has stuff about home care, it's got financial, it's got legal, it's got assisted living facilities, elder services, Cape Cod Senior Resource Guide. I'm gonna leave them here, I wanted you to take a look at this, please take one. They're also, their website is also great, and actually Jim Monty who is the owner of Oasis for us. He is in charge of this group, and since he's done that, this used to be 3 pieces of paper. Yellow for one thing, I think red, a light red was for residential or home care, and it's just, so there were 3 different ones, so this is a great resource. I also want, if anybody's interested, Elder Services, their website is also really good. It used to be horrible, but this is a nice one, and this actually is a much better brochure as well, provides their opportunities. I also brought some of my cards there. And again, I think, the open house, the name change, I think, for the state agency really does send a message. We're trying to get away from the word seniors, because that has a negative connotation for a lot of people. So I like that the state's really looking at how are we gonna help us grow older well, instead of, okay, just put them in this box, right, like it used to be. So, take advantage. Oh, and Heidi said the bocce ball court, let's see. I think that is it, right? Any other questions, especially for Carol? We're very fortunate to have her here, or grab the information, and a great resource. I have referred a lot of folks to these guys. I'm just starting to do that, but whenever I need anything, they've been able to help me. So thank you, Carol.
It's a pleasure.
Yes.
How many volunteers do you have help out here at the senior center? I'm curious about what their age group is.
We have about 85.
Wow.
Yes, and there used to be, I think, double that pre-COVID. And their age, I'm gonna say probably mostly 70s.
Early to mid-70s. We need volunteers.
Well, thank you for having us
Okay,
here.
thank you.